Here's an exclusive Spotlight PA investigative report.
I'm Spotlight PA correspondent Mitch Blocker. Pennsylvania closed many of our state psychiatric hospitals and promised care closer to home. But over a decade ago, money for that community-based mental health care was cut. And our investigation found many psychiatric patients wind up in one of the worst places for care, jail. Across Pennsylvania, county jails have become some of the state's busiest psychiatric facilities. That's according to the private health care company working inside 37 county jails.
They saw this as such an obvious issue that a private for-profit prison healthcare company gave us their data.
Prime Care shared a decade's worth of jail and prison healthcare records with Spotlight PA.
So when people are coming into the jail, Prime Care is assessing them, right, for, triaging, right, for medical needs, but also for mental health care needs.
Investigative journalist Danielle Ohl poured through the records with the Lehigh Valley Justice Institute. 7 years of records revealed a repeating pattern. Year after year, more suicide watches, more medication, more people with mental health needs behind bars.
Even in that short time frame, we saw an increase in suicide attempts, an increase in people needing psychiatric medication.
They have to go somewhere. These aren't folks who are going to disappear. They're going to be in our communities.
Joan Ernie oversaw hospital closures across the state.
Have we traded one institution for another?
No, I would say this. So treatment and good community work and expertise around how it is that you intervene with someone with mental illness is what's necessary. State hospitals are not the solution, nor are prisons. Those are not the solutions to giving people what they need.
Yet funding cuts, sparked by the Great Recession, siphoned money away from community-based psychiatric care. Even as jail populations shrank, the number of people with serious mental illnesses grew.
People who have serious mental illness often get picked up by the police at a much more frequent level and for much more incidental issues.
For decades, state commissions warned that without community care, prisons would begin warehousing the mentally ill. The latest report found that is exactly what happened. One of its conclusions: jails have unintentionally become the largest providers of behavioral health services in the Commonwealth and are not sufficiently prepared and resourced to meet this population's needs.
Put aside the fact that we should not need people to hurt other people to get health care. Prison generally is not therapeutic, is not a good place for you to be if you have a serious health condition or serious mental illness.
State leaders knew this was coming. Now families across Pennsylvania are living with the consequences.
I think more people than you would think are dealing with something like this. If it's not themselves, then it's a loved one.